Thank you guys for joining us. Thank you, everyone. We are live not only in Zoom, but also on Facebook today. Today is our South Florida Community Connections series debut. Our first topic is lung cancer and COVID-19. This series is brought to you by Memorial Cancer Institute and the Jean and Sue Folden Charitable Trust. It is a speaker series that we have put together to talk about the most pressing issues in lung health. We hope you will join us as we continue to do these series quarterly. In order to get involved or to know about the next upcoming speaker series topic, please like us on Facebook. Our handle is LungSoFla, LungSoFla. The other thing that you can also do is go to our turquoisetakeoverchallenge.org website. This is Turquoise Takeover Week. We hope everyone chooses to turn turquoise with us to bring lung cancer out of the dark and into the light. For today's webinar, I wanted to go over some quick housekeeping rules. Again, this meeting is being recorded and it is also live on Facebook. In addition, if this is meant to be an interactive session, so we want to hear from you. We want to have your questions about lung cancer and COVID-19. At the bottom of your screen or top for some, you should see a Q&A button or Q&A option. Using that functionality, you can ask questions directly that we will pass on to Dr. Domingo. So now to get us kicked off and started, I am going to share my screen and share a video from from our partners at Memorial Cancer Institute. A quick message from them, and then a welcome from Dr. Reyes for Dr. Domingo.
Cancer doesn't wait because we're living in a pandemic.
Early screening can help improve the chances of cure.
Go back to your doctors. Keep up with your routine cancer screenings.
Because cancer doesn't wait.
And you shouldn't either.
And to help stop the spread of COVID-19, Memorial Healthcare System reminds you to take these simple actions. Frequently wash your hands, wear a mask, and practice physical distancing from others. And let's stop the spread together.
Good afternoon, everybody. My name is Luis Reyes. I am the medical director at Memorial Cancer Institute, that is part of the Memorial Healthcare System here in Broward, South Florida. I am also a thoracic oncologist. I'm a lung cancer advocate. It's a pleasure to be here with you. We support tremendously with all of our energy any initiative that Lung Force and the American Lung Association has. This is a very important cause, and we are very happy that all of you are supporting us today. I am going to introduce today Dr. Gelenis Domingo. She is one of our thoracic oncologists. She's an expert in lung cancer. I have the pleasure to work with her at Memorial Hospital West. She originally was trained in South Florida. She's from South Florida, and at the University of Miami, where she did her residency, Jackson Memorial Hospital, and then she went to Tampa to Moffitt Cancer Center, and finally she went to Chicago to the University of Illinois, where she completed her oncology training. Now we are very lucky that we were able to bring her back to work with us and helping us in this novel cause. So we do here together with other two people doing lung cancer, doing clinical trials in lung cancer patients, and doing a lot of advocacy like the one that we are having today with Lung Force. So thank you very much for tuning today. Thanks for your support. As I said again, Memorial Healthcare System and Memorial Cancer Institute are here for you and for our patients to fight this lethal disease. Thank you.
Okay, we are back live. Dr. Domingo, I am going to pass everything over to you, and thank you, Dr. Reyes, for that wonderful introduction.
Thank you. Good afternoon. I'm Dr. Domingo, and it's a pleasure for me to be here this afternoon to hopefully answer some of the questions that our patients may have in relationship to COVID-19, specifically for patients that have a lung cancer diagnosis. So I don't know if we wanted to start with some questions already from the patients, or should I start with some of the questions that we kind of came up here on our own that address some of the key topics and questions that our patients may have?
So completely up to you. If it might be actually helpful to kind of get the conversation going, if we could maybe talk about some high-level things to know about lung cancer and COVID-19, and then we can do some questions after that. So all of our attendees, please feel free to start asking questions and putting them into the chat.
So I think it's very important that we address this topic. Lung cancer remains the leading cause of cancer death in the US. And you know, over 100,000 people are expected to die of lung cancer in a year. And so it's important. It's a large group of patients, and now with the pandemic going on, we know we've had so far over 30 million patients that have been infected with COVID-19, and over a lot of our patients have questions on how does that relate to lung cancer and what kind of things they should be looking out for, whether vaccines are recommended. And there's a lot of questions that we receive from our own patients regarding the pandemic and how it pertains to answer here today. So I can go ahead and read some of the questions that we have here from some of our patients. The first one being, what do you think are the possible long-term effects of COVID-19 on lung cancer patients? And to answer that question, there's several things that come to my mind. Obviously, you know, a large group of our patient population, so patients diagnosed with cancer, around 80% of our patients have a history of smoking. In addition to the lung cancer diagnosis, some of our patients are already receiving treatments that may, in addition to the pre-existing lung problems that they may have from the smoking, the treatment may also add damage to their lungs, such as radiation or surgery, sometimes with immunotherapy, which can cause some, in rare cases, can cause inflammation of the lungs. So those are all things that we consider when we have a patient that now also has the diagnosis of COVID-19. Our patients, we have to watch more carefully. Sometimes after a COVID infection, patients develop chronic fatigue. Sometimes they develop chronic difficulty breathing or chronic cough. And these may be similar to the effects that the patients can already have from their underlying lung disease or from their lung cancer treatment. So sometimes for us as oncologists, we have to be very mindful and be very good at collecting the clinical information from the patients to try to differentiate which ones are related more to the infection or more to the treatment or to the cancer itself. We ask our patients to stay in touch with us and let us know of any symptoms going on. We suggest very close monitoring and follow-up of these kinds of patients. Another issue that comes to mind is a lot of patients, since the pandemic started, have postponed some of their screening tests, usually for lung cancer. For patients that have a chronic history of smoking around the age of 50 years old, we recommend a screening CT of their chest once a year. And some of those screening tests have been postponed. And so patients may be presenting with more advanced disease. And that may also be an additional risk factor for patients to get complications with a COVID infection. In the long term, we don't know which patients are going to develop the complications, which patients are going to develop chronic coughing or chronic shortness of breath from the COVID. But definitely our cancer patients have increased risk of these things happening. So we have to be very aware. We have to provide very close monitoring and start treatment for these patients with whatever we have available right now, which could be antibiotics. Sometimes we use steroids, we use remdesivir, we're using convalescent plasma, we're using monoclonal antibodies to try to prevent these complications from happening in our population of patients, even though they have this underlying lung cancer in addition to the COVID.
That sounds good. Dr. Domingo, we are wanting to ask another question from the audience. What are the side effects cancer patients could be concerned or should be concerned about after receiving their vaccination?
So, I don't think we have seen something specifically related to patients with lung cancer in terms of the side effects of the vaccine. For the most part, the vaccine is pretty well tolerated. There are some reports of patients getting, for the most part, the more common side effects are soreness at the site of the injection. Some patients get fatigue. Some patients get a low-grade where you can develop fevers from the treatment or from the immunosuppression from the treatment, to try to differentiate which one is causing the fever. Was it the injection or the treatment itself? That's something we have to be aware of. In terms of, there were some reports of the vaccine causing clots, I think mainly for the Johnson & Johnson. It was initially withheld for them. Very concrete correlation between the clot market and it's available again. And some of those are hard to tell because we know that the virus in itself has increased incidence of clotting. We've seen up to 20% of patients diagnosed with COVID can have clotting complications. So sometimes it's difficult to tell whether the clot develops as a result of the vaccine, the cancer itself, which can cause clots, or maybe patient also had a prior infection with COVID, and that's what led to the clot. So some of those things we're still trying to figure out, but just to be very watchful with our patients and their symptoms so we can try to differentiate what is the cause of what.
So another question that we had was, as a lung cancer patient, should I consider getting the flu shot and the COVID-19 vaccine?
Yeah, so we recommend for all our patients to get vaccinated with both the flu injection and the COVID injection. Anyone that has lung cancer, like we said before, most of the time lungs are already compromised by possibly underlying emphysema, by the tumor itself, maybe by the radiation treatments or the immunotherapy treatments that they're receiving. So we want to try to avoid at all costs anything else, such as an infection that can further damage the healthy lung tissue that's left. So for our patients, I think it's even more important that they receive any protection that comes with inflammation from a COVID or a pneumonia infection. So yeah, we highly recommend for all our patients to get vaccinated.
Very good, very good. And now on the flip side of things, a question came in about how do you manage your health and lung cancer related medical needs if you are diagnosed with COVID-19?
So anyone with lung cancer, we typically follow a similar algorithm that we would follow for a normal patient. However, obviously, we keep in mind that the patient has higher risk of complications from their cancer diagnosis. So they may qualify for additional treatments that may see. Referring to specifically the monoclonal antibodies, the best benefit for this treatment is within the first 10 days, and it's given to patients that are not hospitalized. So not the patients that are very, very sick that are requiring oxygen and are not able to leave from the hospital, but more the patients that are at home, they're stable, but because of underlying conditions such as diabetes, COPD, immunocompromised state, or cancer, which are most of our patients, qualify for this treatment, which can prevent them developing complications from the COVID. So we tell our patients, anytime you get diagnosed, at the diagnosis, please let us know. If it's diagnosed at Memorial, we have the records, but if they get diagnosed somewhere else, we instruct them to call us right away. So that way we can start treatment to prevent them from developing complications later on from the COVID infection. And that's what I've been doing with some of my patients. And in my personal experience, it's been pretty successful. So far, my patients have done pretty well with early treatment of their COVID.
Perfect. So thank you for that insight. And a fear that I think we all have right now with COVID and being around groups in particular is, can we be around groups? And so one of the questions that came in asked, And I know we're jumping around a little bit, but this I thought was a really interesting question. I'm concerned about being around a group of people during this time, during COVID, as a lung cancer patient. Are there any suggestions on how to enhance my protection?
Yeah, so there are several things, several guidelines that are out there, things that we can do to prevent catching COVID-19. It's the respiratory virus. So the way I think of this is how the same way that you would catch something that you're more familiar with, like how do you catch influenza, or how do you catch the normal flu, like the normal upper respiratory infection, like rhinovirus or adenovirus. It's a similar way, like the more likely source is someone that's very sick, that's very close to you, like maybe a friend or a child that's very close to you, that's the highest risk of catching it. But there are other ways that we can catch it, like sometimes it can live on surfaces for a while, we can touch that and then touch one of our, open areas, our nose, our eyes, and it can come in that way. So the things that we can do is, hand washing is one of the main things. Wash your hands at all times. We can use also hand sanitizer as long as it contains alcohol of more than 60%. Make sure, we're somewhere like do not touch hands or face or eyes with dirty hands before we have washed them. Other things that we can do, masks. There was not a lot of data on that, but it seems like more and more data has come out and it seems to offer some degree of protection. It may not be 100%, but they are good at decreasing the rate of spread of the aerosolized bacterial particles that patients are putting out or coming in. So that's another way that we can use to protect ourselves. I would say, obviously, if you're a lung cancer patient, I would advise my family, my friends, anyone that has any symptoms at all, that they're concerned that they could have COVID or they were exposed, to try to avoid any contact with me or my immediate families or caregivers. When you're out, wear your mask. Right now, there's a recommendation for regular patients that have been vaccinated to remove the mask if they're in an open area. If you're a lung cancer patient, don't feel comfortable doing that. I think it's also acceptable to continue wearing your mask even if you're in an open area. You still should wear your mask in an enclosed space or when meeting with large groups of people to try to get some additional protection from that. Obviously, we recommend that all of our cancer patients get vaccinated, and that seems to be probably the best protection that we can get against getting the infection or the complications from the infection. It seems like most of the vaccines have a pretty high rate of effectiveness and almost close to 100% decrease in complications from the COVID. So I recommend that all our patients get the vaccine.
Kind of double tapping on this a little bit, you talked a lot about masks. One of the questions actually asked directly about masks, and it talks about the CDC guidelines and the abilities now to not wear masks around other people that are vaccinated. Mm-hmm. So as someone with lung cancer, as a lung cancer patient, the question is, should I keep my mask on even though the guidelines have relaxed? Mm-hmm.
You can, it's a hard question to answer. I think if you're both vaccinated, the chances of transmitting an infection, we don't have the exact number, but it's pretty low. The amount of the patients you can still catch the virus. It's probably not going to develop into a full-blown infection, but you can shed some of that virus and maybe infect someone else. If the next person is also vaccinated, what are the chances that they're going to become very sick from whatever small viral load that they're getting from another vaccinated person? I think in general, the risk is very low. But if someone wants to feel more protected and safe, I think it's bad idea just to keep their mask on, especially if they're undergoing active treatment with chemotherapy, where your immune system's also decrease from the treatment. I guess it may be like a little different. Maybe a patient will feel more comfortable if they have finished their treatments and they're in remission, and we're just watching to see if there's something that comes up. So I think it varies from case to case. But definitely, if you feel more safer wearing your mask, I encourage that. That's something you should do.
That makes a lot of sense, for sure. So we have a question from Facebook. Is there any advice on how we can improve our lung health at home? For example, breathing exercises.
So, I mean, you can, some of the ways that we tell our patients, especially in the hospital, but that's something you can also do at home. Some patients use incentive spirometer. It's a device so you can blow in it, and it makes you take deep breaths and open up the alveoli. Like that's kind of like exercise for the lung. You can try doing something like that at home. It depends. Some patients already require like oxygen at baseline. So if you're one of those patients, I think you need to stay on the oxygen as needed. There are some patients that require a mask to sleep, like a CPAP at night. And I think that can also help. You know, if you're one of those patients, make sure that you're being compliant and using the mask every day to make sure that that lung tissue is open. I would say, you know, if you're able to exercise and make sure that you're practicing your breathing, taking deep breaths, all of those, you know, when you lay in bed for a long time, the lung tissue is kind of pushed back against the bed, and you can develop atelectasis, or like it's like closing of the lung tissue, and that's not very healthy. So whatever you can do to walk around, take deep breaths, and exercise your lung should be helpful.
Well, thank you. Those were a lot of really great ideas and a lot of good things to consider too, like the medical devices that need to help the process of being able to breathe better. So very good. So we have another question from one of our Zoom attendees. What about and this is a little bit of a different direction. What about the possible side effects from the second dose? So second dose of the COVID vaccine. And this question specifically asks, do we need to take special precautions?
So, there's 3 vaccines right now that we're able to administer. 2 of them require 2 doses. Patients can develop side effects from the first or the second or both, but it sounds like it is becoming more common for patients to get more side effects after the second dose.
Dr. Domingo, would you mind repeating?
The side effects so far don't seem very dangerous. Like most of the patients that get side effects is usually fatigue, fever. Most commonly they get soreness at the site of the injection.
Dr. Domingo, don't mean to ask you to repeat yourself, but your audio is actually moving in and out a little. Would you mind taking it from the top?
Chrissy, did you want to start again?
Please.
Start that answer again?
Yes, please.
Side effects related to the second injection, right? So it seems like most commonly from the second injection is when most patients tend to develop more side effects. And the side effects usually include something like soreness at the injection site. Some patients get fatigue, fever, headaches. Those are the more common things that patients are experiencing with the injection. For the most part, in my experience and what has been reported, the side effects are very short-lived. It's usually less than 2 days, most likely 24 hours. Some patients we recommend them to take Tylenol or ibuprofen even before the injection or right after, to prevent some of those side effects from coming on, or you can wait to see if you even develop any. Some patients go for their 2 shots and do not develop any side effects except the soreness at the injection site, and do not need to take any anti-inflammatory or anti-fever medication. But if you're concerned about the side effects, that is something you can do. You can take some Tylenol or ibuprofen, maybe like twice a day for the next couple of days, just to avoid experiencing the side effects from the injection. Are they referring to the side effects of allergies? I mean, there are some patients that can develop an allergic reaction to the injection. That usually happens within the first 15 to 30 minutes. And that's why in most centers of vaccination, they're asking patients to at least stay for 15 minutes for monitoring. And if that were to happen, usually it's like a rash or itching. Those patients get treated right away with antihistamines and cortisol to decrease the allergic reaction. And so far, it seems like we're doing pretty well with that as well.
Well, and got it. That's a really good point too. Just
Does
that wait period.
answer the question?
It does, for sure. And for the audience, I will say we are going to be wrapping up. So if you do have questions, make sure that you put them in the chat. If you're watching us live on Facebook, please put those questions in the comments. Dr. Domingo is very happy to answer them. So the next question that I have for you as we start to wrap up the day is there it's the same line of thought with the vaccines, not necessarily about the second dose, but maybe that factors into the answer. Is there a vaccine that is better if I'm currently dealing with lung disease? So in this one, it's a little bit more of a broad question. It could be lung cancer, it could be asthma, COPD. Is there a vaccine that would be more recommended? So it looks like we have lost Dr. Domingo's audio. I will share that if there are additional questions, please do put them into our chat and we will email out the responses.
In terms.
So we will email out the responses to any questions that you have after the meeting. So please do feel free to continue to ask questions and we will provide answers. I wanted to thank Dr. Domingo. So I want to thank Dr. Domingo for her time today. And also just say thank you so much to our audience for tuning in to our very first Lung Force Community Connection Speaker Series. We had a good topic today with lung cancer and COVID-19. And hold on one sec. There we go. We had a good start to our Lung Force Speaker Series today. And we will be continuing. Please be on the lookout. This is a quarterly.
We have the Pfizer, we have the Moderna.
Dr. Domingo is definitely committed to answering all of your questions for sure. So as I said,
can you hear me?
We are going to continue with our speaker series. The next installment we are going to have come out over the summer. So please do like our Facebook page, LungSofla, LUNGSOFLA, so that we can provide you with updated information on the next topic and the next installment of our speaker series. It's also a great place to learn about the activities that we are doing during Lung Force Turquoise Takeover Week. This week, we have a ton of stuff going on. I wanted to say a special thanks to our partners at Memorial Cancer Institute and the Sue and Jean Folden Charitable Trust for supporting this endeavor and for helping us to educate our South Florida community. Thank you all and have a wonderful day.